wanted to make a quick video. Actually, right now I'm in the middle of looking some drugs up in this PDR, which is short for Physician's Desk Reference. I actually have to look up a whole bunch of these medications for a homework assignment. I've got like 25 medications which I have to look up, and I need to find out what their generic names and their brand names are. And I have to find out what they do, what their indications, and also what their contraindications, which is actually things that, like side effects that happen from, like adverse side effects that happen from taking this specific drug. I actually have to go through all of these, and I got to figure out what are the brand names, what are the generic names, and then there's the chemical names, so proprietary names, brand names, generic names, etc. One thing I've learned from taking this pharmacology course so far, I know it's still early on in the course, that there are brand names and then there are generic names. Now, the generic names are actually the same as the chemical name of the drug itself. So basically, the brand name and the generic names it's exactly the same drug, and it all it boils down to is who owns the brand name, and they can charge more just because it's a brand name. Doesn't mean that the medicine's any better. It's not. It's actually the same thing if you have your physician or doctor write you a prescription for a drug, and it happens to be that your insurance company won't take the brand name, so they'll write out a prescription for the generic name, and in reality it's actually the same drug. There's no difference in strength or quality. And it's weird how that works. Because you see all these commercials on television that advertise all the different types of drugs out there, and they only advertise, obviously, the brand names. What's the thing here? We've got advertisements for Lipitor, which is the heart medicine, and then you've got drugs like Zoloft and Plavix and such. And what it comes down to is that there's actually generic names for them, and the generic name, as I said earlier, is actually the same thing as the chemical name itself. So when you're looking up at a PDR or even this nursing drug guide, you'll find that you have to look up the chemical name in order to find out what the brand names are and such. I just wanted to make a quick video, just giving you guys an update of how everything is going. Like I said in my last video, things have been pretty grueling. And actually one course that takes the most time to do the work is my pharmacology course. This is actually the textbook for the class, and this is my PDR, which I got in the mail 2 days ago, because I'm going to need this in order to look up different types of drugs and what they do and what they're meant for and all this other information about them. Right now I'm actually looking up a specific medication which is called diazepam, which is actually the chemical name for Valium. And this is for anxiety disorders, and also if anybody who's an alcoholic who want to actually come down from the withdrawal effects, they actually administer a little bit of diazepam for them, because if they don't, then they can go into cardiovascular issues and such. So it actually has a lot of, like other drugs, it has dual purposes. The main purpose is that they use it mainly for panic disorders and anxiety disorders. But anyway, I'm looking this one up right now. I have to write what it does. Like I said earlier, that's what my assignment is right now. It's quite tedious, but I think in the end I'll probably end up learning something about all the different types of drugs. Obviously, I'm not going to learn them all, because there's, as you said, this is an enormous book, and it's got God knows how many medications in here. It's amazing. I guess you just want us to learn a general overview of all the medications that are out there, and so that's what the purpose of this course, I guess, is, just to have a general knowledge. Okay, I'm sorry if I bored you at all, but I just wanted to give you all a brief update about how I'm doing, and homework time. It's a lot of fun. Oh, anyway, I guess I'll talk to you guys later. And as always, thank you for watching my videos. I really do appreciate it. And cheers for now.